Welcome to Skinside Out, where we uncover the science, trends, and truths behind skin health. Your trusted guide to the world of dermatology. This podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional.
Welcome to Skinside Out, where science meets beauty. I'm your host, Dr. Zane, with Heather and Courtney. So today we're going to be talking about a topic that millions of people experience and struggle with, acne scars. So if you've ever dealt with acne and the lingering effects with acne scarring, we're going to talk about the different types of scarring, how we treat it, and how things have advanced over the years and how effective treatments can be.
Yep. So we'll talk about the different types of acne scars because there are a few different types. And then we'll also talk about the best treatment options in regards to those specific types.
All right. So let's start off by talking about what acne scars are. So acne scars literally are scars developed from the effects of inflammation on the skin from acne. So as we know, acne is an inflammatory skin disorder that's complex. It's got hormonal influences, bacterial components. There's a sebaceous gland that's overactive. So all of these lead to inflammation in the pilosebaceous unit, which is where the hair follicle, the glands, meet the skin, and that's the environment that acne is formed. Now, when there's intense inflammation, that can in itself lead to scarring if it's severe enough. However, also physical trauma, like us picking at our pimples, can lead to trauma and lead to scar tissue.
Yeah, and kind of going off of what happens when your body thinks that it's been injured or like when you have an acne spot, your body is trying to produce more collagen to help kind of heal that area. And sometimes it can produce too little or too much, and then that can leave a scar too. But not all acne scars are the same. I think it's important to make sure you have an understanding of the type of acne scarring that you have because treatments are different for each type.
Absolutely. So what are the types of acne scars? There are two broad categories that I divide them into. One is atrophic scars, one is hypertrophic scars, and there's a third category which are really not true scars at all. They're called post-inflammatory hyperpigmentation or pigmentary changes. So let's dive into that a little bit.
Yeah, so I'll talk about atrophic scars. That is the most common type of acne scarring. This is pretty much that classic indentation or depression of the skin from the scarring. So there's three types of atrophic scarring. There's ice pick scars, boxcar scars, and rolling scars. So ice pick scars are pretty much, if you could imagine like taking a little toothpick and just drilling it into your skin, it creates that tiny little indentation. That's an ice pick scar. Boxcar scars are pretty much like a U-shaped scar with pretty defined edges, but it's a little bit bigger than an ice pick scar. And then the last one is rolling scars, which are pretty much have a wavy appearance to it, and that can be due to the damage under the skin.
Unfortunately, there are hypertrophic scars. So when we think hypertrophic, we think keloids, and that is, again, that overproduction of collagen. I think we tend to see a lot of keloid or hypertrophic scars on people who have chest and back acne, especially like around the shoulders and chest area. It's really prone or sensitive to getting that keloids, especially in our patients with skin of color. Yeah. Sometimes, unfortunately, we do see this on the face, and it can be really devastating for patients because it's more raised. Sometimes they can be itchy, painful. So, they can grow beyond that original acne site and kind of keep growing sometimes. It's just really tough for the patient.
Yeah, and I like to touch on those non-scarring types that a lot of people misdiagnose as scarring. So post-inflammatory hyperpigmentation and post-inflammatory erythema. Let me break those down a little bit. So post-inflammatory hyperpigmentation is very common with any type of inflammation in the skin, especially in skin of color. So what happens when you have inflammation in the skin, like with acne, when the body is, reducing the inflammation and it subsides, it can lead to deposition of pigment or melanin in the skin. And that can take weeks to months, sometimes even longer, to fade. So that is not true scarring where that is below the surface of the skin and you're forming like scar tissue. This is not scar, this is pigment. And post-inflammatory erythema is kind of that redness that you see within, areas of, resolving acne. And that is also not true scarring. There's no scar tissue that's forming, but there is redness from the blood vessels that kind of form. Also often be commingled with the post-inflammatory hyperpigmentation. So the two can coexist.
Yeah, a lot of times for patients who maybe have treated their acne and now just have that post-inflammatory hyperpigmentation or erythema, a lot of times I'll tell them to maybe do some chemical peels or things like that, which we'll get into, but before they actually think about treating the true acne scarring, because sometimes that redness or the pigment can almost create a shadowing effect on the face where it looks like there's scarring there, but there's actually not. It's just that discoloration.
Yeah, so it's really important to understand the type of scarring we're dealing with because they may dictate different treatment modalities. And oftentimes with more severe scarring, it requires more intensive therapy and multimodal treatment. So, acne scarring is not a one-size-fits-all. We're doing a really thorough clinical assessment, making sure that the acne is well controlled, and then we can kind of talk about the different options we have available, whether it being topical, whether it being a procedure, whether it being a light-based or energy-based treatment. So it's really, really nuanced. So let's talk about some of the topical treatments we often use as conservative first-line therapy. So one of my favorite ingredients, as we have talked about in other episodes, retinoids. So these are topical vitamin A derivatives that help with not only treating acne, it also helps with the hyperpigmentation from acne. It also helps with scarring by producing collagen that can help with some of those scars that we see.
Vitamin C is another topical that you may use. It's really not going to change the scarring, but it's great for that post-inflammatory hyperpigmentation or post-inflammatory erythema or redness. It's really just going to focus on brightening the skin and fading that pigmentary change.
We'll often use our alpha hydroxy acids or beta hydroxy acids. So those are going to be your salicylic acid, your glycolic acid, lactic acid, things like that. Like Heather mentioned, these are not going to be your first line treatment for treating scarring. I think all of the topicals in general, if you have pretty significant scarring, are more of adjunct treatments to help keep that skin primed for your in-office procedures. But they will help, the hydroxy acids will help at least for the discoloration aspect and clearing up some of that, PIH or PIE, the post-inflammatory like we were talking about.
And like as you mentioned, these are adjuncts and they will help enhance any of these in-office treatments that we're doing because it's going to help with stimulating collagen and helping to normalize those inflammatory skin changes that we see. And, obviously we'll have certain instructions for our patients, like when to discontinue certain treatments prior to a procedure and when to reinitiate them. But it's kind of like a whole program that helps us to optimize your results.
Yeah, I always feel like you have to have kind of that good foundation, that good base in order to complement those procedures, because if you want to maximize, you're spending money on these procedures. Insurance doesn't cover any of this. So if you want to maximize your procedures and having the good at-home skincare is going to help do that.
Yeah, and sun protection is a must.
Yeah.
When you have inflammation in the skin, like with inflammatory acne and those post-inflammatory changes with pigment or erythema, UV light is going to prolong that inflammation and may lead to worsening of the inflammation. So if you don't protect yourself, it's really going to be challenging to get optimal results.
Next, we'll go into in-office procedures. So I'll start with microneedling. This has so many great perks, but it is amazing for acne scarring, especially the atrophic scars. So like those ice pick scars, boxcar scars, and rolling scars. It really stimulates collagen production over time to help smooth out that texture.
Chemical peels are another procedure that we'll use. Again, I don't think peels will be your first line treatment. However, there is a procedure, TCA cross, that we'll utilize for some scarring. The TCA cross is basically a procedure where we use TCA, trichloroacetic acid, and that typically is used for full face chemical peels at a lower percent, maybe a 10%, a 20, or a 30, depending on how much peeling you want. But this basically stimulates collagen production, and for this TCA cross, we actually actually utilize it at 100%, sometimes 90% or 100%. And we actually take a fine, like toothpick type device, to essentially put onto these spots. Now, you're not going to treat your like rolling scars with these or your boxcar. It's mostly those ice pick, because as Heather mentioned, it's going to be almost like a toothpick, right? That created this like little indentation. So what happens is it becomes really frosted in this white discoloration pretty quickly. And then sometimes you can get a little bit of like almost like a scab for about a week. The downtime's actually pretty mild, pretty easy. It's a really great procedure, and that just helps to kind of remodel that skin over the course of several sessions.
But you have to be really careful.
Oh, yeah.
I mean, it's a very high percentage of TCA. If not applied precisely, it can worsen the scars. If you apply it to the wrong type of scar, like a boxcar scar or a rolling scar, it will make it wider. So you have to be really careful about treating patients. And, commonly, it's thought of like you can't do it on skin of color. You can do it on skin of color, but you just have to be very safe and precise about it. So next type of treatment is one of my favorites, laser therapy. So lasers have really changed the game in the past decades for treating really bad acne scarring. And, we have non-ablative as well as ablative lasers that can help. And many times we're employing them in a fractional way, meaning that we're kind of poking tiny little holes into the skin with the light energy, and that will form a wound response, which helps to stimulate collagen synthesis, but also resurface the top layer of the skin as well. However, based on how much destruction you're doing, so the ablative lasers obviously have more destruction. It's like obliterating the top layer of the epidermis. You will have more downtime. So you're looking at, up to like 2 weeks of downtime with the fractional CO2 lasers, the erbium lasers. But they get really nice responses. If you're not really an appropriate candidate, like if you have darker skin type, or if you really don't have that kind of downtime, non-ablative fractional lasers can be very helpful. So we have both of those in my practice, and we kind of just base the treatment options on skin type, what they're trying to accomplish, and the type of downtime they can afford. Not everyone can take off 2 weeks from work, especially if you're not, working from home. It's difficult. So, it's kind of an investment, but it does work really well.
I think that's the nice part about working in dermatology is because we can look kind of deformed
crazy
temporarily, but we're always doing something. We had an employee earlier that she would always mention, "Oh, I'm under construction. Don't worry about me." But so I'll get into the next in-office procedure. It's called subcision. So not a lot of places do this. So you definitely want to go to somebody who is trained and has that knowledge and technique to do this. So subcision is where we actually go underneath the skin to remove those tethered areas. So it happens with these scars that creates this scar tissue that almost like anchors down within the skin. So I like to kind of describe it or think about it like a boat that is anchored in the ocean. So you have that anchor that is holding that boat or that scar down. It's pulling that down, and not necessarily with the boat. That boat is hopefully staying on the surface. But think about that anchor. You're pretty much going underneath the skin or under the water and removing that anchor. And so that is a more invasive procedure. It's definitely a little bit more uncomfortable. So typically we put like a topical numbing cream on. We often will do nerve blocks where we're injecting the nerves within your skin to help minimize discomfort, and we see pretty good results with it.
I see amazing results with it. I think it's actually one of my favorite treatments, especially for atrophic scarring. I almost pair it with all of my acne scar treatments as part of the treatment plan, because if you don't release that scar tissue, it is still going to be tethered down. And once you kind of subside through those, tethered scar tissue, you release it. So it lifts up almost immediately. And I'm often infiltrating it with PRP, platelet-rich plasma, or PRF, to get those growth factors too in that area to help almost stimulate that wound response so that you can get that collagen production. And it's a game changer because, I've done lasers, RF microneedling alone in tandem, but sometimes those really stubborn atrophic scars do not lift up enough. And although you see improvement, you can definitely see more improvement once you combine it with subcision. So I am a subcision believer, but it's not without its own, set of complications, right? So you have to be very comfortable with anatomy. Like we are literally taking at least an 18 gauge needle. Sometimes I use a Noker needle, sometimes I use cannulas, but they're like really large. So you need to know your facial anatomy, blood vessels, nerves. You need to really help patients with the pain control because it's not comfortable. So we use Pronox too in our office, which uses nitrous oxide, also known as laughing gas, to help calm down patients. But, I'm doing nerve blocks. I'm also doing like, tumescent anesthesia to really make the patient comfortable while I'm kind of really going in there. And I'm going pretty aggressive. But, patients are obviously swollen. Sometimes they can get bruised. I warn them ahead of time with the consultation about that. But the healing is pretty remarkable. And each time we do it, we usually do 3 sessions at least, a month apart. It becomes easier and easier for me to kind of get through that scar tissue because a lot of it's been released. And we see some really nice collagen synthesis and really nice outcomes. Patients have been floored by the results. And many of the times they have come to me after going to other providers who have done the lasers, they've been at the Medi Spas, getting their RF microneedling Morpheus, complaining about how much it hurt, and they really don't see that much of a difference. And then even with 1 session with subcision, game changer. That is the magic sauce, I think.
Yeah, it is, and it's so fascinating to watch. I mean, just those you can really actually see and hear the bands, and I'm sure you can kind of feel as you're going. It's really fascinating. Just and I always joke like that's the day that you get your arm workout in because you're really going under, and some of them are really stubborn. So it is funny each time you see someone back, and you're like, oh, this one was a lot easier than last time because a lot of those bands have now been released. So it does get easier. But
it's oddly satisfying hearing that band and feeling it.
Yeah, for you, not for the patient.
Just like kind of like.
Dermal fillers we utilize on occasion. I think the nice thing about dermal fillers, here's the pro and con, right? The pro is that you do see that instant kind of gratification where I think a lot of acne scarring treatments are, I always say they're kind of under the skin. So you're not going to see this visual change like a chemical peel, right? Where you're seeing your skin slough off. It's going to be more underneath the skin, all of that collagen production doing the work. So sometimes it can take, 6 to 8 weeks to see kind of the effects of that first treatment. The dermal fillers are nice because, you do get that immediate relief or that immediate response, but they do only last for, maybe a year and a half, maybe 2 years if you're lucky. So I think they have their place for some, but I think there are other more effective treatments.
I think the biggest thing is kind of utilizing those biostimulatory fillers like Sculptra.
Game changer.
Yeah, to really create like a scaffold for collagen synthesis.
I like using that treatment modality way more than just your HA fillers. HA fillers are like nice for like, small areas, instant gratification, but long term, I feel that Sculptra and Radiesse can do a lot for stimulating our collagen and longer lasting results, and it also improves skin quality.
Yeah.
So you get a lot of benefits. Lastly, in my office, many times patients come in with, a big zit, right? And of course, it's their wedding next week or, prom's around the corner. So we often inject interlesional Kenalog, usually dilute, to help reduce that inflammation very quickly and safe, effective. So if you have a big event coming up and you got a big zit on your face, just call your dermatologist. Don't pop it, please. And Courtney's really good with also doing some spot treatments with, AHA, BHA, topical treatments. Obviously, acne scars are a very emotional topic because these are scars that typically stay with you for the rest of your life. And many patients, even after their acne has cleared, they're not having any active breakouts anymore, their scars remain. And although, acne scars, there's nothing wrong with them, a lot of people feel self-conscious about them. And even with my acne journey, I had pretty bad, cystic acne when I was a teenager. It was hard to control. And then, eventually I went on Accutane. And then I did Accutane, cleared up my acne. But what did I have left? Scars. So I really hated the scars. I was very self-conscious about them. I was in dermatology during residency, and then I'm looking at all my co-residents who have perfect skin. Everyone in dermatology seems to have perfect skin. And I had these scars, and I felt bad about it. And, I was treating patients and learning about all the different treatment options we had, medical, surgical, cosmetic. And it was during my residency where I got a lot of exposure to cosmetic dermatology under my mentor, Dr. Tina Alster, who is a world-renowned laser, expert. And, she actually treated my scars when I was a resident. And, we did non-ablative fractional lasers. That's something commonly that she did in the office, the Fraxel, essentially. And that helped. And then I also did microneedling. I did radiofrequency microneedling. I've obviously done tons of chemical peels, but still, was struggling with some of the scars. Although a lot better, I still felt like I wanted to do more. So, I did some more like RF microneedling, PRP injections, subcisions. And although my skin's by no means perfect, it's a lot better than what it used to be. Makes me feel better. And I'm still on a journey. This is under construction. So
we all always are.
Yeah. And then whenever I find a few minutes from clinic, which is very hard, I continue my treatments. But it is a journey, and we have the treatments and the tools to really help you, get those results you're looking for and really improve your skin health.
Yeah, and I guess we all have been through our own acne journey here. Although Heather's face, you can't tell. You have no acne
She's
scars.
like perfect skin.
Yeah, and she's like, I had acne. I'm like, where?
Yeah.
But yeah, that being said, you're not alone in that. I mean, if your providers have dealt with that, it just goes to show how common it is. And
honestly, it's one of the reasons why I went to dermatology.
Yeah. It's why I became an esthetician. It was, acne, and it's why Heather became a PA.
I'm not just bouncing off of you, okay?
She copied my acne. But luckily there's so many different ways. And I'm really excited also to see how much more we'll learn about this, scarring and what treatments, we've talked a little bit about like growth factors and exosomes and PDRN. So it'll be really interesting to see what else is kind of out there on the pipeline as far as acne scarring treatments go.
Yeah, and we're already incorporating that in our treatment plans in our office, like, post-procedure exosomes and PDRN, and then also red light therapy post-procedure. I mean, we're really trying to marry the science and technology with all the offerings that we have in a comprehensive approach.
Yeah, I think the key thing with acne scarring and treatment options is to really be patient and consistent with your treatments. This is not an overnight thing. I mean, the only exception with that would be like an HA filler, and that is not something that's used for every single type of acne scarring. So everything else is going to take time. Be persistent, be patient with it. You will notice improvement over time.
Yeah, and I will end with this. I know that a lot of teenagers struggle with acne, and parents are always hesitant about treatment. It is far better to treat it early, properly, and not develop the scars than having to go back and treat it. It's a lot more expensive. It's not guaranteed. It's painful. So we're big proponents in early treatments and having that plan in place so you don't develop these scars. Like, look at all three of us. We have all dealt with our acne struggles, and wouldn't it have been just so nice not to have to deal with it?
And I was going to do a little, name drop on the Accutane, because I do, I was thinking about it earlier when we were talking about this episode, and both Dr. Zane and I have been on Accutane, and I think it really did save both of our skin. And I wish that, I didn't get into it until I was actually working in dermatology when I was in high school. We have a very similar. When I was all through high school, I had really bad cystic acne, and, God knows if my parents had, even known about Accutane. A lot of derms will have to do a whole episode just on Accutane because it's such a controversial subject, but for us it's a no-brainer. I mean, just prevent the scarring, a lot less heartache in the long run. But
I really wish I had done it as a teenager, but my parents, they were just scared. They hear about the side effects and all that. And with the proper counseling monitoring, it is a safe medication and can really prevent a lot of heartache down the road.
Yeah.
All right, so acne scarring is pretty complex. It's not as simple as people think. There are different types of scarring. There are different ways that we can treat it, and it really requires a customized approach for a treatment plan. So you need a good team that can really properly diagnose and treat the situation. And it's going to require time. It's going to require probably multiple treatments, but we can get you there. So, make sure that, when you're getting your acne scars treated, make sure that you're seeing a dermatologist who can really look at, your skin health, and a team that can really provide you with the optimal treatment. Because let's face it, I mean, it's not cheap and it's expensive. It's an investment. It's a journey in yourself and your self-confidence. So we can be there as advocates to help you on your journey. I think that this was a really, pertinent topic that a lot of people struggle with. It definitely hits home with all of us. And I do think that a lot of people are suffering with acne scarring, and I think that there really aren't any solutions there, but there are. So just make sure that, you seek the care of a reputable expert so that we can help you on your journey. Please like, subscribe, and until next episode, Skinside Out.
Thanks for listening. This episode of Skinside Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717.